Hi, my name is Emily Saccone, and today I will be presenting how CRISPR gene editing is being used as potential treatment for muscular dystrophy. In my introduction, I will discuss muscular dystrophy, also known as MD, Duchenne muscular dystrophy, known as DMD, and CRISPR-Cas9. The muscles are very complex, which means they need specific parts to function correctly. In MD, one or more genes for producing those parts is faulty, meaning it isn't working properly. This leads to a breakdown in the muscles, structures, and function. DMD, which is the most severe form of muscle dystrophy. It mostly affects males, and that typically begins in early childhood between ages of 2 and 5. DMD caused by a mutation gene called dystrophin. This is an important protein that helps keep muscles functioning and protected during movement. Without it, the muscles become fragile and more susceptible to damage. This leads to muscle loss and weakness. Then there's CRISPR-Cas9. This is a gene editing tool that can address the cause of DMD. It is guided by a RNA molecule that directs it to a specific location in the DNA where the mutation caused by DMD is located. The goal of CRISPR-Cas9 is to improve muscle health and function. Once the CRISPR-Cas9 reaches its target site, it can modify the DNA, correcting the genetic error that prevents the production of healthy dystrophin. CRISPR-Cas9 also offers possibilities for treating DMD by restoring the ability of muscle cells to produce functional dystrophin. This will also improve muscle health and function. What is CRISPR? Here at the top you can see I put what it stands for. CRISPR-Cas9 is a precise gene editing tool that can address the underlying cause of DMD. Of course, the faulty gene. It acts like a molecular scissor guided by a special RNA molecule. The RNA directs the Cas9 enzyme to a specific location in the DNA where the mutation causing DMD is located. Once it gets to the target site, Cas9 can modify the DNA and it corrects the genetic error that prevents the production of healthy dystrophin. CRISPR-Cas9 offers possibilities for treating DMD by restoring the ability of muscle cells to produce functional dystrophin, which of course will improve your overall muscle health and function. In this slide, we will talk about CRISPR mechanism of action. In the first step, that is gRNA binding. A specifically designed guide, like I said, gRNA, locates and binds to a specific target sequence in the DNA, which is often at a mutation site. Then the gRNA acts as a GPS almost and directs the Cas9 enzyme to the precise location where it can start its editing. In the second step, that is when the Cas9 cutting begins, and the Cas9 enzyme, which is guided by the gRNA, it then cuts both strands of the DNA at the targeted site. This then is creating a double strand break, and that cut is crucial in the steps because it initiates the gene editing process. And in the third step, that is cellular repair system activate. Basically, once the DNA is cut, the cell's natural repair mechanisms are activated to mend the break, and there are two primary pathways. Those two are non-homologous end joining and homology-directed repair. The first one is a pathway that is used to disable faulty genes by rejoining the broken ends. Then the second one, that pathway is used to introduce specific changes or correct sequences. This slide, we talk about muscular dystrophy pathophysiology. DMD is caused by mutations in the DMD gene, which are located on the X chromosome. And the DMD gene provides instructions for making dystrophin, which is very crucial for protein, because that protein is used for healthy muscle fibers. Dystrophin is a muscle's protective protein. Dystrophin acts as a shock absorber, and it connects the muscle cells, specifically cytoskeleton, which is the inner structure, to the extracellular matrix, which is outside support. This connection provides structural integrity and protective muscle fibers from damaging during contraction and relaxation. What would happen without dystrophin? Well, your muscle fibers would become very fragile and more prone to damage during normal muscle contractions. And these repeated cycles of damage will lead to inflammation and the replacement of muscle tissue with fat and connective tissue, also known as fibrosis. There's also some consequences of muscle damage, and the progressive loss of muscle tissue leads to weakness and loss of function, and it'll affect the skeletal muscles, which leads to difficulty with moving. And it can also impact your heart and respiratory muscles, which can cause life-threatening complications, which obviously you don't want. So it's very important to be proactive and look out for any signs or symptoms of this. Next, we will talk about the types of CRISPR-based edits for DMD. There are 3 types. We'll start with the exon skipping. This allows for the production of a translated but functional dystrophin protein. It is crucial for mutation. Well, it is as crucial as mutation, often leads to frame shifts, preventing proper protein synthesis. The next one we'll talk about is nonsense mutation correction. This method specifically targets and corrects premature stop codons with the dystrophin gene. These stop codons normally prevent the full production of the dystrophin protein. So when they are corrected, this allows for the synthesis of a complete and functional protein. The last one is the upregulation of utrophin, which is very similar to dystrophin. That approach aims to increase the production of utrophin, which can act as a compensatory protein. The symptoms of DMD by performing some of the functions normally carried out by dystrophin. So basically it's the same thing as just dystrophin. And it can be used to compensate for any issues you are having. In this slide, we will talk about causes and risk factors of DMD. Muscular dystrophy is typically inherited, meaning it is passed down from other family members. Mutation in the DNA is passed down from parents to children, but however, sometimes spontaneous mutations can also occur. So it's important to just know your family history of muscular dystrophy. And even though spontaneous mutations, there's only 30% of cases of that, it could still occur, so just be aware. And like I said before, it mostly affects males, and females are usually carriers. Signs and symptoms of DMD. There is early childhood onset and progressive symptoms. The early childhood symptoms usually occur between the ages of 2 and 4, like I said before. And you'll notice symptoms such as difficulty walking, running, and climbing stairs. That is a result of progressive muscle weakness, particularly in the legs and hips. And these are mostly affected early in the disease. Then there's frequent falls. Muscle weakness and balance issues lead to this, and you can also have some waddling with your walking, which is due to the weak hips. Then there's more progressive symptoms. These symptoms worsen over time as the disease gets worse, and muscle weakness increases. There's loss of ambulation by your early teen years. As muscle weakness progresses, most individuals with DMD will require a wheelchair for mobility. Then Then there's cardiomyopathy, which is also known as heart failure, and DMD can affect the heart muscle, which leads to an enlarged heart and difficulty pumping blood effectively. Then there's respiratory failure, which occurs in the later stages. Weakness in the muscles responsible for breathing can lead to difficulties with coughing and ventilation, and this could potentially lead to mechanical assistance to help you breathe, because obviously you wouldn't be able to breathe on your own as well. And that pretty much sums up the signs and symptoms of DMD that you want to look out for. In this slide, we will be talking about the different treatments for DMD. There are certain medications. That one specifically, you see, it can be given to slow down muscle degeneration. Then there's also supportive therapies like physical therapy, ventilation, and braces. Physical therapy basically helps to maintain function, muscle function, flexibility, and mobility. Whereas ventilation addresses your respiratory issues you're having, like I discussed in the last slide. And braces are just to provide support for weakened muscles and aids in movement, especially with walking, such as maybe using crutches or maybe a wheelchair. But also know the limitations, because these treatments do not address the underlying genetic cause of DMD. The effects of these treatments will diminish over time as the disease progresses. And you want to figure out the underlying issue and not just look at the symptoms. In this slide, we'll talk about CRISPR as a new treatment option. CRISPR offers a more permanent solution. By fixing the DNA itself, we're addressing the cause and not just looking at the symptoms. Scientists have used CRISPR on lab animals with very promising results in restoring muscle strength and function. As you see here at the bottom where it says preclinical success, they have used mouses and dogs. They use models of those to show restored dystrophin and improved muscle function. These trials are still going on today, and they've been very successful, which I think shows a very promising future for anyone suffering with muscle dystrophy. Here we're going to talk about clinical trials and progress. It's important to know how vital the role of clinical trials is in improving the lives of individuals with DMD. They're very essential for research and development of new treatments and therapies to improve the quality of life for anyone affected by this condition. We'll talk about a few key things here. First, safety. Ensuring patient safety is very paramount, especially in early phase trials evaluating new therapies. The delivery of treatment. Efficiently delivering therapeutic agents to the target muscles is a significant hurdle. And there's the long-term effectiveness, which is evaluating the sustained impact of treatments over time, which is crucial in understanding their true benefit, of course. And then there's potential immune response. The body's immune system may react negatively to some therapies, which limits their effectiveness, and this has been an ongoing area of investigation. In this slide, we'll talk about the advantages of CRISPR therapy. Compared to older methods, CRISPR offers greater flexibility and precision in targeting specific DNA sequences. By directly addressing the underlying genetic cause of a disease, CRISPR therapy holds the promise of potentially permanent solution rather than just managing symptoms. If the edited genes are stable and passed down during cell division, the correction can be maintained throughout the patient's life. And one really important advantage is it's less invasive than current therapies. While current methods often involve surgery or other invasive procedures, CRISPR therapy may be less invasive and potentially administered through injections. One example would be in a case of sickle cell disease. CRISPR-based therapies are being explored as a less painful alternative to bone marrow transplants. At the bottom here, I put can transform treatment of other inherited diseases. The ability to edit genes with precision opens the door for treating a wide range of inherited diseases caused by a specific genetic mutation, and researchers are exploring CRISPR-based therapies for diseases affecting various organs and tissues. This includes the liver, eyes, and muscles. And I think the biggest advantage of all of this is it's less painful, you don't have to go through surgeries, and it just seems like a better treatment. And I think, in the future, they'll be very successful with this and continue on with it. Challenges and ethical considerations. Let's talk about the off-target effects. That is a risk of unintended mutations occurring at locations in the genome other than the intended target site. Then, with immune response, the body may reject the Cas9 protein, which of course is an essential component of the CRISPR system used for gene editing. And ethical concerns. Ethical considerations surrounding the use of gene editing in embryos or germline cells. And then here at the bottom, delivery barriers. The difficulty in effectively delivering the CRISPR components to all the affected muscles in DMD patients. In this last slide, we'll talk about the outlook on the future, which I believe that there's a very promising future with CRISPR-Cas9. CRISPR technology is set to play a significant role in the future of healthcare by advancing personalized medicine. The technology's ability to edit genes precisely allows for the development of highly targeted therapies, which we discussed before. These therapies can address the root cause of genetic disorders instead of, like I said, just looking at any symptoms, especially diseases such as cancer, which, as we know, cancer has been a problem for many, many years, and there hasn't been too many successful treatments with cancer, and it'd be nice to have a more promising treatment, such as CRISPR-9. While there's challenges related to delivery efficiency, off-target effects, and long-term consequences need to be addressed, research and innovation in the field are ongoing. Like I said before, there's constantly research on this and articles that you can read about it. These include advancements in delivery systems and the refinement of CRISPR tools, which hold the potential to overcome these limitations. I think the main goal is to have a more effective, safer, and accessible treatment, ultimately providing improving patient outcomes and changing how disease management is approached, giving a patient their a good life expectancy and it's just a better life overall, quality of life. And I find this all very interesting, and I think everyone should look into the CRISPR-Cas9.